going to talk about a few things today. I'm aware you've had a long and an action-packed day, lots of information, so I'm not going to kind of go into too much detail, but I'm obviously happy for you to contact me. I'm going to talk about the social care workforce, and I'm going to focus on that particularly because actually in terms of people with dementia, obviously alongside families and friends and sort of informal carers, if you like, the social care workforce are going to be the primary bit of the workforce that are going to be supporting people with dementia, although I would absolutely stress, obviously in an integrated way with our health colleagues. I'm going to talk about the key challenges that we actually face, and then I'm going to talk about some of the priorities that we've got at the current time, which, as I've already alluded to, very much link up to our colleagues in health. So, a little bit about the size and scale of our dementia workforce in social care, first of all, because this often surprises people. So, across the UK at the current time, actually across England, the total size of the social care workforce is around about 1.5 million people. So, it's a huge sector, and of those, about half of those are providing direct day-to-day support to people with dementia, and we've heard some of the stats around the number of people with dementia earlier today, and obviously the amount of people that are providing support. So it is a huge workforce. At the current time, in terms of where we're at around progress, and I'll talk more about our kind of tiers and levels a little bit later on in the presentation, but in terms of that day-to-day support, there's roughly around about 400,000 people that are trained at the level we need them to be at. But obviously what that also means is we've got 400,000 people who aren't at the current time. And certainly in terms of our priorities going forward within Skills for Care, with the Dementia Programme Board, with the Dementia Workforce Programme Board, which I chair alongside my colleagues at Health Education England, that has to be our priority, that those kind of day-to-day staff. Our challenge within social care is very real in that our workforce is often turning over. So on average, and it is going up a little bit as we're kind of monitoring the figures, but on average, if you look at a typical care service across the UK, you've got around about 30% turnover per annum. So that is a significant turnover. However, the flip side to that is, and this is hugely positive, what we do also know is that just around about 2/3 of those people actually remain within the social care sector. So I think that is a positive for us, and obviously training and workforce development can be a real contributory factor to keeping those people within our sector. And then across, this is across England, we've got around about 20,000 social care providers, typical care homes which people will be relatively familiar with, but also don't forget our home care agencies as well, so people going obviously into people's own homes to provide the care and support as well. So I mentioned that challenge around retaining those staff, and it is a big issue for us within the sector. However, the good news is Skills for Care has done some research over the last couple of years, and what we've been able to do is identify some providers that have got a lower than 10% labour turnover figure. And what these sort of points on the right of the slide are actually saying is, broadly, people are leaving providers, they're not necessarily leaving the sector. And actually, if providers have good managers, if those managers are flexible, if they train the staff, if they look after those staff, actually, let's be quite honest, what we all want in terms of the relationships with our managers and with our employers, actually the evidence says those people will stay with those providers. You'll notice on that slide that pay is pretty low down that list. So it is important, and I'm not saying that it isn't, but actually there are other factors other than pay that actually are really contributing to the turnover challenge that we've got within the sector. A little bit about the policy landscape now, and I think we've talked a lot about this earlier, and it was very helpful just reflecting on Martin's slide earlier around the policy landscape that we've had around dementia over the past sort of 15 years or so. And I would completely agree with him. I do think that has moved things forward in a number of different areas actually. Research you've obviously heard about, but I would also include workforce within that as well. However, there is still more to do. So again, as we've heard, it is very much around the 2020 challenge at the moment, but there will be a new challenge launched in due course to take us up to 2025. As part of the work that we've done within the 2020 challenge, there has been a meaningful care programme of work that has specific elements of focus work, one of which was workforce, which I happen to chair. And we made some good progress actually with that piece of work in terms of clarifying what the workforce needs to be trained in. But I think the critical bit for us now is how do we actually get the workforce to that point? And I'll talk a little bit more about that in just a few moments. We've also got the Dementia Workforce Advisory Group, which I mentioned earlier, chaired by myself at Skills for Care and also Professor John Clark from Health Education England. And this is very much around leading the workforce challenge, particularly across England. And we've also had a recent call to action, again, across England as well. So I do think we're making progress, and I do think, there's lots of positive news stories, but I still think there is more to do. And I think it's fair to say in terms of the dementia policy landscape at the moment, certainly with respect to social care, we're obviously very much awaiting the Green Paper, because I think, we all recognise that there is a longer term funding question for social care. The government recognises that, everybody recognises that. So I think we do need to be aware that there will be kind of more stuff coming out about this, hopefully over the next sort of 2 or 3 years. So, in terms of the specifics around training, what is happening? Well, we've got a 3-tiered framework, which we've had for a little while, but the Meaningful Care Group, which I spoke about earlier, has done more work on this to refresh that framework. And broadly, what it's tried to do is to essentially develop 3 tiers of training. And essentially, this slide is telling you all about this. But broadly, it's essentially saying that all staff working across health and social care need to be dementia aware. Wherever they are across the system, they need to have an awareness of dementia. Tier 2 is around that day-to-day contact with people with dementia, and this is the big gap at the moment that we need to work on, and this is the gap that I alluded to earlier. So we do need to do more on this, and you will see our efforts over the next few years, thinking with respect to the next challenge, will very much focus on this area, and that is across health and social care. And then tier 3 is very much around the support that specialists need, that leaders need, and also that managers need as well. And I'm not going to go into all of the detail around all of this, but you can start to see there, certainly in terms of social care, some of the occupational groups that we're talking about within that group. But essentially what the framework has allowed us to do is set up a series of learning outcomes for people wherever they're working across the health and social care system, to say these are the sorts of things that you need to be able to do and that you need to be able to do in order to deliver the high quality care that we all want to see. And in terms of the content of that framework, again, we haven't got time to go into the detail of it today, but if you just look at the slide there, there probably won't be too many surprises as to the content of what the framework is actually covering. And obviously the 3 tiers that I alluded to earlier cover all of those different 14 areas, but obviously to differing degrees. And all of this information, by the way, if you look at the Dementia Training Standards Framework, if you just Google it, it will take you to the Skills for Health website who hosts the framework. As I say, it's very much a partnership between HEE, ourselves and Skills for Health, but you can download a copy of that framework if you want to have a look at it. But certainly in terms of any activity that Skills for Care are doing, that HEE are doing, that Skills for Health are doing, anything around this workforce space, you will always see that now it's related back to this framework. We've also got a ton of resources on our website as well. They are obviously, given what we do, particularly focused on social care providers and the social care workforce, but they're equally relevant to healthcare professionals as well. And I do think the more that we can do around this space really to provide as much support to people as we possibly can, the better really. And then I put my contact details on the slide as well. More than happy to take questions, because I'm aware it has been a bit of a whistle-stop tour, but we're also going to have a bit of time for questions now as well. So thank you very much.